so. So welcome again, everyone, to Workforce Priorities. The conversation continues, using human resources to support organizational health and resilience. My name is Daniela Labate Cavelli. I am from NYAPers. We're a MCTAC partner, and I'm joined today by my colleagues Marlo Passion from the Coalition and John Coppola from ASAP. So before we go ahead and get into the material for today, we have just a little bit of housekeeping stuff. So today's webinar is being recorded. You'll notice there was probably a pop-up around consent around recording. The slides and the presentation will be posted on the MCTAC website. We have built some time into the presentation today for Q&A, and we hope that it's actually not a presentation today. We hope that this is more of a conversation with you all. So we're going to encourage you to use the chat box and other features to communicate with us. If you're new to MCTAC, MCTAC is a training, consultation, and educational resource center that offers resources to all behavioral health providers throughout New York State. And our overall goal is to prepare and assist providers with the transition to Medicaid managed care. So here's our partner slide. You'll see ICL is also on here because ICL actually put the Workforce Priorities webinar series together, and then we decided we would take it sort of a step further and do the conversational piece. So we have 3 learning objectives for you today. We hope that after today, your self-awareness will become a little bit broader for your own organization's culture. We hope you'll be able to identify one actionable item for you to begin to address as part of your organization's culture, and also to think about how you can better be prepared to face any external factors that could contribute to your organization's culture. So like I said earlier, we really do want you to join the discussion. You'll be able to unmute your phone if you like. In order to do that, you just hover your mouse over the lower left-hand portion of the screen, and then just click on either the telephone or computer speaker icon, depending on how you connected to the meeting today. We hope that you'll use the chat box to comment or discuss any topics today. If you don't feel comfortable speaking up in the larger group, please feel free to use the chat box. And when you do chat into all, what's it called, all panelists and meeting attendees, I want to say. I made a note here, and of course I forgot what I wrote. Chat to all panelists and attendees. That way everyone can see and everyone can join the conversation. And the last thing that we would ask is that you try to minimize distractions by muting yourself when you're not speaking, so we have a little less background noise, because we do have a nice group of folks on the phone or on the Zoom with us today. So with that, I'm going to turn this over to my colleagues, John and Marlo. And I think, John, you're going to kick us off with this first chat question, right?
Absolutely. So first of all, let me just say good morning to everybody. I'm really happy to be with you, and happy that each of you is able to join us. I want to just reiterate a couple of things that Daniela said before we kind of launch into the question, and that is we really value your presence and value your time, and would really look forward to hearing your voice. We're looking at a screen, and we're not able to see your smiling faces and all of the nodding and just the sort of eyes riveted to the screen. But it would be great to hear your voices. So encourage people to unmute and chat if you feel like doing that, and most definitely to take some time to introduce yourselves to others in the chat box as well. So again, my name is John Coppola. I'm the Executive Director for the New York Association of Alcoholism and Substance Abuse Providers. We represent prevention, treatment, recovery, and harm reduction programs from throughout the state. And been very, very happy to be involved with MCTAC and working with organizations across the state in terms of really looking at the business practices of the field and how we can really be stronger and just adapt to the environment. And sort of that idea of adaptation and resilience is going to be really one of the themes that we'll be talking about throughout the day today. So I want to spend a little bit of time just kind of breaking the ice here and understanding, who's on the webinar, and having a little opportunity to meet some of you, and then launch into the content of the presentation. So at this point, I'd like to say hello to Marlo and ask Marlo to maybe introduce herself a little bit, say a little bit about who she is and where she is, et cetera.
Thanks, John. Hi, everyone. I'm Marlo Passion. I'm the Director of Training in the Center for Rehabilitation and Recovery at the Coalition for Behavioral Health. As a trade organization in New York City, we provide advocacy and training to New York City's providers. And I specifically represent a team of passionate trainers who stand for recovery and rehabilitation. And I'm here today, very passionate about this topic, given the, as you might be aware in terms of current events, the upheaval and the change that most of our teams have gone through during this period, during this year. So hopefully this will be an opportunity for us to reflect further on where our organizations have been all this time and where we want to go in terms of reclaiming and sustaining the health of our organizations. And since we have a fairly intimate group, if you'd like to unmute yourselves and introduce yourselves to us, we'd love to get to know you.
Hello, my name is Carol Otero. I'm the Human Resources Director with Central Nassau Guidance and Counseling Services located in Hicksville.
Hi, Carol.
Welcome, Carol.
Thank you.
Good morning. I'm the Program Director at League Education and Treatment Center. My name is Teresa McInerney. In Brooklyn, sorry. Brooklyn.
All right, Brooklyn represents.
Yeah, good morning.
I am slightly biased. My name is Clinton Green. I am one of the trainers for the Center of Rehab and Recovery. And I work with Marlo as well as supporting various recovery-oriented programs throughout New York City.
Great. Glad to have you with us, Clinton.
And then just another reminder, folks, if you feel like you want to just chat into the chat box who you are, where you're from, please feel free to do that as well.
Yeah. Anybody else who wants to unmute? And again, Daniela, maybe just one more reminder on how to unmute if people want to do that.
Yep. So in order to unmute your phone, you can do it by hovering over the lower left-hand corner of your screen. There's either a telephone receiver icon or a computer speaker icon, and just tap on that to unmute yourself, and you should be good to go.
Great.
Hi, my name is Nilsa Gomez. I am the HR Director for Little Flower in Hauppauge.
Great. Good morning, Nilsa.
Good morning. Yes, we actually have locations in Long Island and Brooklyn and Queens.
Great. All right, Daniela, why don't we move into our first discussion, and just happy to have everybody with us, and look forward to I look forward to a good conversation. Just while we while we start to launch, if there are any specifics, any specific points that people want to make sure we touch on before Marlo and I move into, we will try to address any specific concerns you have, or if there's something special that you were hoping to achieve by participating in this workshop. It might be a good time to just take a minute to hear some of that as well. So if anybody has anything they want to let us know about, want to make sure that we touch on, that would be wonderful.
Yeah, we're here for you. We hope you get the most out of your experience with us today. Anyone? Any takers? Hi, Douglas.
Hi. Yeah. Hi. I would love. I mean, maybe this is something that's self-evident, but in this time, especially in behavioral health agencies, how to balance the work, the needs of the clients, the needs of the staff, especially with the challenges of, if you have young children in school, the needs of the organization to continue to try to meet the government funders' goals, and how you sort of see that balance being achieved. I don't think there's any one answer to it, but I'd be curious on your sort of thoughts, and even others, because I think that's something we're all trying to struggle with.
Yeah, that's huge.
Thank you, Douglas. That's definitely on each of our minds. I think moving forward to maintain our organizational health, you spoke of balancing work, the needs of the people we support with the staff that we support, even, especially staff members who have young children, balancing work with perhaps childcare and like the need for their children to go back to school. Some of the colleagues that I've collaborated with and have heard from, it's definitely kind of like a heist when they plan for back to school. And so hopefully we can share some tools and resources with you that might open opportunities. And as we go along to discuss organizational health, I'll just give an introduction. So depending on your agency, organizational health might have a few different dimensions and it might be unique to you. But we've listed some here just as inspiration. It might entail values that align with the mission and vision of your organization. It might entail resources and structures set up to build a sense of community within your organization, structures and policies and procedures that foster and nurture the people that work for you, your workforce, factors that can add and enrich leadership. Sounds simple enough, right? I guess, John, do you have anything to add to what makes organizational health in terms of factors?
I think that the questions that Doug raised is very much rooted in what's going on in communities and in the environment, and also in the organizations where people live right now. And I'm hoping that as we move through our conversation today, we'll definitely be hitting on, I think, a lot of those points as we move through. The focus today is going to be on organizational health and resilience, and specifically from the perspective of HR. And again, we're going to, I think, be discussing it as a two-way street. It's not just an organization that has expectations. It's about employees and volunteers that have expectations, and how do we sort of manage those in a virtual environment or in a hybrid environment where some people are working from home and some people are working from the office. That's clearly a challenge, but I do think we'll be able to kind of cover a lot of that as we move through.
So in the next slide, we see that there are certain measures that we can use to get a better sense of our organizational health. Some of those measures may be static, and as Danielle and Eve lovingly call it, these are some of the vital signs of your agency, factors that kind of give you a snapshot of the organizational health. It could involve annual statistics or things that you might report on to your funders or to your other stakeholders. What does the financial status look like in terms of revenue coming in and the costs to operate? What do we have ticked off in terms of our boxes for compliance with regard to the necessary regulations, policies, and expectations of people involved with our organization? What does our workforce currently look like in terms of the trainings, the knowledge, skills, and practices that they currently have? And what does the satisfaction look like on the consumer level and on the team level? But all of these, again, only give you a glimpse of what organizational health might look like. There's also another measure in the next slide, which offers us a more dynamic view of organizational health. And these are really ongoing, ever-evolving measures with regard to the intersections among the mission and values of your organization with some of the interpersonal dynamics that might be involved. For instance, the world of work has an organizational cultural assessment questionnaire that give your organization really the language to speak effectively about the culture that you currently have or the culture that you're creating. They capture a summary of the current working culture in the team, and it gives you a written reference of what your team might look like as you evolve the culture further. And there's no right or wrong answers once you take the questionnaire, the survey. It just gives you a picture of what is, which you can consider in developing steps to move forward to enrich your organizational culture to ultimately align with the mission and values of your agency. And
Marlo,
I guess, yeah.
Is that a questionnaire? Is there a link on at the end of the program to that?
Yeah, and I think Tara has given our audience the link through the chat box at present. It's also going to be contained at the end of the slides.
Beautiful.
Yeah, and I guess part of this reflection process, in addition to the questions in the cultural assessment, we might consider for ourselves a few, additional general questions. For instance, what do we consider currently as our organization's strengths? What can we prioritize for sustainability's sake? What are our needs in terms of our team dynamic? And what are opportunities for us to keep pushing for positive change and growth? So a lot of big questions. I do think that there needs to be prioritization. I've heard that if you have way too many priorities, you don't have any, right? And so in considering a lot of different issues for a lot of different people, there's a need for us to kind of funnel it down to what matters most to our whole organization. And I think in the next slide, we might actually have a definite definition of organizational health. So organizational health basically means our team's capacity to function effectively as a unit, to cope with the impacts of change, and to grow together in cohesion and in alignment with the organization's mission, vision, and values. And this might entail defining aspects of our workplace, the safety and comfort of physical environment. A few questions to come to my mind, and this might be unique to my organization. One question to ask might be, do we have access to resources for our basic needs? At this time, does our office space have adequate ventilation to meet the recommendations for public safety guidelines, in the context of this pandemic? In considering the inclusivity and the, well-resourcedness of our personal environments, do we have, if this matters to us, do we have gender-affirming bathrooms? Just to think of the whole bathroom scape, are they accessible to staff and guests in wheelchairs? Are they up to code, basically? Do we have private breast pump stations for nursing mothers? It's kind of in the little details sometimes in considering how considerate our workspaces are.
I think one of the things that, from your last slide that really relates to all of this is the idea that it's across the organizational hierarchy. So these things are not, let's say the benefit of the upper management of the organization. And so these are sort of privileges that you earn as you progress through the organization. It's a sensitivity we want to have across all parts of the team, that everybody has that sense of value. And so everybody's physical space needs are important. Everybody's personal needs are important. And really, as we kind of focus on everybody, the needs of everybody, it kind of has an effect on the overall environment and really as a major contributor to the organization's health.
Yeah, John, I think you're talking about equity, which I think goes a long way in terms of sustaining the organization's resilience overall. I think morale goes a long way. In terms of how we talk about mutually respectful relational environments, I guess we could consider people from different cultural, socioeconomic, ethnic, religious, political, sexual, gender, regional, generational backgrounds, and those who have lived experience of a mental health or physical health condition. Would they feel welcomed and accepted in our workspace? Can we tolerate diversity and perspective taking in our work environments? Which I gather it's kind of a tall tall order. But again, we're going towards what would matter most for our organization and what would be unique to us. But just a few things for us to consider. I guess on the next slide is, I guess, the meat of our conversation today is around resilience and what would help us all, you know, go that extra mile for sustainability.
I think it really gets to the heart of Doug's question as well. You know, to what extent are we, and again, from an HR perspective, we think about the environment that we're creating as, you know, and what is our responsibility to all of the staff, all of the volunteers in the organization. To what extent are we creating a you know, sort of a rigid set of expectations for exactly how things should be done and what needs to happen and when, or to what extent are we building in some flexibility so that when things happen either in the internal environment or the external environment. And again, if you just think about COVID for a second, and you know, to what extent have we had to deal with loss, death and loss, or fear in the actual workplace where we've had people who have passed, people who've gotten sick, or people who've been afraid and exposed to COVID, but maybe we're fortunate enough not to get it. To what extent have we been able to, you know, create an environment that's sensitive to that, and at the same time, understanding we live in an environment where external to our organization, you know, there's the need to make amazing changes and amazing, you know, shifts. You know, we've talked, you know, right now, so many of us are, you know, waiting with bated breath as the folks in Washington are looking at, you know, possibly some additional aid for states. And there's an uncertainty about if it'll come, and if it does, how much will come. And so if you think about what does that mean in each of our organizations, how much anxiety and fear is there about loss of funding, layoffs, furloughs, reduced workloads, reduced revenue, et cetera. And then how is our environment equipped to be able to respond in as healthy a manner as possible? You know, are we nimble? Are we flexible? Are we able to speak, you know, with staff at all levels in a way that sort of engenders their sort of engenders their willingness to kind of support and work, you know, toward a healthy outcome? I think, you know, as you look at some of these, you know, dimensions of resilience, you know, that nimble, flexible, and agile are really, really imperative. And, you know, the other thing, you know, when you think about, you know, how decisions are made, you know, when COVID first, you know, when the governor first started shutting things down, it said, okay, Broadway's closing, and you can't have gatherings of 50 or more people, and then 30 or more people. And then, you know, we got to a place where people were basically told that not to go to work unless they fit certain categories. That really required immediate response. And to whatever extent people were capable of thinking a day ahead, and I don't know that too many people were able to think much more than 1 or 2 days ahead because things were changing so quickly and rapidly. You know, to what extent does the culture in the organization support quick decision-making and the ability to adjust either to internal or external significant changes? So do we have a decision-making process that involves getting a large group of people sitting around the table, hashing it out, reaching consensus, reaching an agreement, you know, with a big group of people, or do we have a situation where it's more driven by the managers in the organization, and are they feeling empowered to make decisions, or does everything have to run through the, you know, executive director or the CEO? Again, all of those kinds of ways of structuring our organizations become really, really important.
So John, this is Daniela. I'm just going to chime in here for a quick second. The last 3 bullets from this slide deck, we actually took those questions from the organizational culture assessment questionnaire that Marlo had referenced earlier on. We really want to encourage you guys to use that link, look it up. I mean, it's a 2-pager. I think it's 2 pages. It might even be less than 2 pages of questions that really helps you to take a look at your own organization and your organization's culture. And we actually think it might be a good idea if not only you were able to fill out the questionnaire, but also had a number of folks who are in the sort of decision-making level fill it out as well, so that you can see, is everyone sort of on the same page around organizational culture for your organization?
If you think about, one of the things that struck me as I was kind of reviewing this slide is, the last bullet about communication being clear, frequent, and transparent. And the one about, clear is probably obvious to all of us, that, we want people understand the words that we're using to communicate, important thoughts and important directions. Frequent, was really kind of an interesting word for me, because out of necessity, it was imperative that organizations have the ability to frequently communicate from a distance, with employees. You didn't have the benefit of calling everybody into a conference room, or, having a series of meetings, inside the organization, or daily check-ins, but it was literally, people in remote settings, and what would happen in an organization that has multiple sites, multiple offices, dealing with multiple departments of health, dealing with multiple regulations at the local. If you think about, the process of reopening, that was driven largely by county. And so you might have counties in phase 1 and counties in phase 3. So how do you make sure you're giving clear communication about who you're speaking to and what you're communicating, and just making sure that the lines of communication are open. Just to give a quick example, when we had a conference call very early on in mid-March, I want to say it was like the 15th or 16th of March, and the purpose of the call was to just kind of have everybody touch base and make sure everybody was okay. And in not having really been ready for the magnitude of what was about to unfold, it was maybe 3 minutes into the conversation, it was very clear that people were, there was some element of chaos, there was some element of panic, there was some element of fear, there was a huge element of the unknown. And it was extraordinarily clear that what we had to do was to not just have one conference call. We had to have more than one, and we had daily phone calls, 7 days a week, until it was I think right up to Memorial Day weekend was the first time we took a weekend and said we need a little bit of a break here. But it was necessary to make that kind of a transition, in that kind of an environment. And again, I think all of us in all of our organizations, this whole concept of resilience, probably every single one of us has learned something about the importance of resilience, and learned something about how we do business that kind of gets in the way of being resilient, or gets in the way of doing or being healthy. And so I think the environment, and again, I think Marlo referenced the whole issues around diversity, equity, and inclusion, and the just horrific events that have taken place in communities across the country, that have really, I think, sort of created an environment where some really horrific issues that are not too far below the surface in some places and right out there in most places, have to be reckoned with. And to the extent that many of us have been asleep at the wheel, or many of us have not been, organizationally been paying attention to how these issues impact our workforce, we absolutely have to be in a position where we're communicating clearly, frequently, and transparent we have to be in a position where we're able to respond, immediately at times when there's a crisis that all of a sudden, is in full gear. And so, and over a long period of time, what are we going to do about these things? It's all about, creating healthy, resilient organizations and healthy, resilient communities.
Yeah, John, I'd like to add that I think one thing that I'd like to pair up with the frequency of communication is the quality of that communication. I think I wouldn't mind frequent communications if I was feeling very supported or very well supported during those times. I think the fact that it's helpful to be clear and transparent can feel really reassuring to people, especially when, the outside world feels very chaotic and things are outside of our control. Can feel reassuring and comforting that we're staying connected and we're staying strong as a unit, as a team during this time. And I'll just note that I've really appreciated the leadership in my organization in that we frequently have weekly calls with each other just to check in, just to make sure that we're all still kind of working as a cohesive unit. And I would also just like to share how much I appreciated like Daniela following up with you and me, John, in this project. She was very frequent. She was very clear and transparent with us in this project. And it's made me feel really supported in doing this project with you all.
Yeah. Great. Are there any questions or comments from folks?
I think Doug is asking how to better balance the need for clear, frequent, and transparent communication with the reality that information is constantly changing and uncertainty is the rule. Yes, Doug, thanks for bringing that up. Most recently, I know there's been uncertainty of when schools would be reopening, and that has left a lot of parents in the lurch of, how to prepare their young ones for school, whether to, bring them back to school in a hybrid fashion, in a full way, or maintain remote learning. And I know they've had to make some very tough decisions in terms of how to go about that. And I know recently there have been updates on delays of school reopenings. And I think our leadership in our organization has been really good at staying abreast with current events so that they can debrief on those new developments with the rest of our teams and give us food for thought on the choices that we have to make as a team. I think in collaborating on contingencies, us as a team have been able to be open about our needs with each other and to be able to accommodate those needs while balancing it out with the demands for work. So that, for instance, one of my colleagues has 2 young children that partially go to school and partially do remote learning. And because we've been able to be transparent with each other about what can be done about that situation in terms of childcare and the need for them to coordinate with school, we've been able to shift some projects, some tasks, so that the other colleagues in our team could support her. So that's just one example.
And I think, I think the other thing, I think there's probably some fundamental organizational values, and we talked about the alignment, between and among all different levels within an organization. To the extent that the values of the organization, mission, et cetera, are all well articulated. And then if you think about the human resources functionality, to what extent, are we creating a work environment that is nimble and can respond to rapidly changing, sometimes conflicting information, so that we have to make some contingency plans based on 2 different sets of information until it kind of gets resolved, where you had maybe the state saying one thing and the city saying something else. Or one county saying something and somebody saying something else, and everybody across the board dealing with different kinds of realities, I think it puts us in a position where we have to have I think it's really all about that nimble management and nimble sort of flexibility, not just at the management level, but also right on the front lines. That how do I respond to a staff member I was expecting to be in a meeting with, who had to go pick up her children because they were closing down the school? I mean, that's a reality. And how do I treat that person? How do I support that person? So again, it just feels to me like that flexibility, the ability for, first of all, to be plugged into good information sources, to understand, where my guidance and structure is going to be coming from, and then to be able to, on the spot, make some judgment calls. Sometimes there was lots of times where organizations had to ignore regulations, state regulations, in order to do the thing that was required. So just as an example, if you had a nurse who was not able to make it to a program, or a nurse that was sick, and you had a patient who had medication, say it was an adult, so do you not give the medication? How do you sort of create an immediate response to the need of somebody when you don't have all of the pieces in order? And so there was some element of common sense that had to be utilized that flew in the face of some of the regulations that people had. So again, I think it was that nimbleness and common sense plays a significant role too.
Yeah, and I think, John, that concept of transparency also comes into play in being transparent with your teams about what you know and what you don't know yet, and just being honest about what we as a team can control in terms of the uncertainty. And I think being able to plan out contingencies with our teams of, well, let's say, schools do reopen during this date, how do we move forward given some of your needs? Let's say the schools reopen sooner. What might change in terms of our workflow depending on our team's needs? And just kind of offering that reassurance that some manner of action can be done depending on the context or the outcome.
And I think, again, to Doug's point, the human resources, the key role, human resource departments, the person in the organization has the human resource functionality, or in smaller organizations that might not have an HR department, people who take on those key roles generally associated with human resources are extraordinarily important. So when you think about, again, responding to information, there has to be a high level position for the thought process that goes on inside the organization relative to making decisions about staffing, to make decisions about how to handle circumstances like COVID. And again, there has to be a sense of security on the part of the staff that when the HR department is involved, that it's something that has the backing of leadership. So the HR has multiple areas of focus. Part of its decision making is recruitment. There's the idea of like, who is our staff? Who do we need? Where are the gaps in the organization? So how do we make sure, in a world where the emphasis is on diversity, equity, and inclusion, what are our recruiting strategies? Who are we reaching out to? Where are the key relationships that we've developed, so that during the hiring process we have a good pool of candidates? We're making decisions that are sort of well-informed, well-informed by data, et cetera. And then, when we're sort of bringing people on, we've done recruitment. We've got good relationships with schools, with other organizations. that might bring me the kind of diverse staff that I'm looking for, and then have a hiring process that's really knowledgeable about, you know, what the needs of the organization are. And then in the orientation period, when you think about when somebody's coming onto the organization, you know, how are we welcoming new people onto our staff? Again, I want to go back to the sort of the bidirectionality here. It's a human being that has needs, has aspirations, has some goals. And to what extent in the hiring process, the recruitment process and the hiring process, are we setting an expectation for what kind of an organization we are? And to what extent does the organization meet the marketing? And to what extent do we sort of deliver on the promises that we made when we were hiring somebody? And to what extent in the process of giving somebody an orientation, are we paying attention to what are the needs that this person brings? What are their aspirations? What is the growth that they expect to get? What is the professional development that they expect to occur? What is the impact that they're expecting to have on people's lives? And then how do we sort of infuse that in so that we're getting what we're paying for, and we're also giving what we've promised people? And again, you know, a good part of that gets communicated through our HR functionality in terms of, you know, how we communicate with staff, how we communicate with our team members, how we communicate with the people who we report to. And is that all clear? Is that all healthy? Is it transparent? Is there, you know, and is it aligned with the expectations that were set you know, early on in my employment and throughout? So is there a consistency from what I was told by a recruiter, what I was told during my interview, what I was told during my orientation, and what I see in the personnel manual, or what I see in the posters in the lunchroom, or what I see in staff meetings on the agenda, et cetera? So if we're creating an environment where the HR functionality is helping people to feel, I think, safe, helping them to feel valued, helping them to feel you know, an important part of the team, with a clear sense of what their role and what expectations are, and with a sense that there's some reciprocity, the organization understands the expectations of the employee. And to the point that was a question that was asked a little bit earlier, I'm expecting some flexibility from my employer as it relates to important family responsibilities. And again, you know, I think one final point I would make, just in terms of, you know, that the whole process has to be data driven. We have to understand some of the information about our employees. We want to understand what their circumstances are, what their education levels are, what their amount of experience is, particularly as we face emerging and changing environments. And if we're asking people to be nimble and adapt, do they have the skill set necessary to adapt to whatever it is that's going to be new or different? Or are they kind of more suitable to an environment which was working pre-COVID but not working so well now? Are they people who can be responsible working from a remote location, for instance? So we look at things like productivity and outcomes from services, particularly as we also go toward value-based payment. You know, are we able to monitor, you know, the work that's being done by staff, and to understand and have that actual factual information driving, you know, driving some of the decisions we're making. So the idea of being consistent and, you know, understanding that the, you know, this is about the employee's journey as well as the expectations of the organization, of our programs and the agency. So we want to make sure, again, you know, I think I said it a little bit earlier in the recruitment process. You know, when we say who we are, it is who we said we are, reflective of what the employee's experience is. You know, are we who we say we are? And you know, is there consistency there? And again, you know, if I hire you for a certain position, is the position what I said it was? Do you have the level of responsibility that I promised that you would have? Do you have the level of support and supervision that I said you would have? All of those things become really, really important. And again, you know, the flip side, of course, is, you know, to monitor and understand whether the employee is delivering all that the employee said that they would deliver. Do they have the skill set that they said they had? Do they exhibit the kinds of expertise that they said, you know, they had from previous experience? You know, so again, it's a constant back and forth of expectations and the degree to which we're kind of meeting the expectations of the employee, and that the employee is meeting our expectations. And again, you know, it's critical that's all transparent, and it's not different from one employee to another. You know, there's a consistency there that you know is really, really you know, important.
Yeah. John, it gets me curious who among our audiences might have dual roles, right? I mean, if HR is being given this critical role, do we have folks in our audience? I think we had heard from one of you. Do you have solely an HR role, or do you have dual roles? Are you wearing multiple hats? And if so, if you're wearing multiple hats and taking on HR, please feel free to raise your hand so that we can get to know you a little bit more.
Yeah,
I think too, yeah, go ahead.
No, go ahead, Marla. Yeah.
Yeah, I think too, in terms of balancing, you know, being able to follow, you know, the, I guess, policies and procedures, maybe the regulations, within those structures, I guess you're communicating that we have to balance that out in doing things in a humanizing way to maintain relationships with the people that we work with. So,
and again, we're fundamentally talking about safety and you know, making sure that the environment understands the needs of employees, and that the employees understand the needs of the program where they're working. And I guess I'd like to just maybe wrap up, you know, this session by just talking a little bit about diversity, equity, and inclusion. It is clearly, you know, when you think about the addiction field, when you think about substance use disorders, treatment, prevention, recovery, and harm reduction, there is a clear link between a lot of the work that goes on in our field and law enforcement and incarceration in jails, prison, parole, probation. And as we think about, you know, the role that our field has played in those relationships, you know, key partners. But, you know, as we look at, you know, something like diversity, equity, and inclusion in an environment like the one that we have right now in the field, in the environment of our field, and, you know, to what extent do we have employees who are having a positive experience of diversity, equity, and inclusion in our organizations? And then what happens when, if we're doing an appropriate job as it relates to diversity, equity, and inclusion in our organizations, what happens when we are in the midst of larger conversations in the community with other organizations which might not have the same kind of a track record? And how do we sort of handle ourselves, and what is our role as an organization? And so if we think about it from the HR perspective again, you know, there's a sort of a multi-dimensionality to it. It's our responsibility to the people who are working in our organization. It's our responsibility to the people that we're providing services to. And it's our responsibility in a broader context, you know, in terms of the community where we're living, the larger community. And on some level, I think we're challenged to ensure that the decisions that we're making internally within HR and within our team building exercise, that it permeates all of those levels at some point. That's a very, very, very tall order, but it's one which, you know, we're really being called to examine, and one which we're being called to deliver on. But I think, you know, as we you know, transition to you know, maintaining a healthy and resilient you know, culture, we want to keep, you know, all of that in mind.
Yeah, and I guess in considering some concrete steps for us to act on moving forward, we've outlined a few for us to consider. One might be to start reviewing something as typical as an employee manual to ensure that it remains consistent with the brand of the organization and what, as John said, what we've promised to employees. And if I can get a little granular, it can be as something as little as the vacation policy, right? What are our boundaries? And what are we naming and honoring? Like, for instance, is there a written clause for vacations, but is there an unspoken rule in your larger organizational culture that folks on vacation might still be on call should something come up at work that requires their attention or skill sets? You know, what structures do we have in place to honor and protect the multidimensional, multicultural values that our teams hold? Are those values reflected in the employee manual? One thing that I'm thinking of in terms of just, again, vacations and PTO, do we have certain holidays as paid holidays in agencies? I know I was very impressed with OMH when they made Juneteenth, you know, June 19, a paid holiday for their employees. That was unprecedented. It's not even a national holiday, but here they are. Where do we draw the line between unpaid leave to observe a religious holiday and paid leave to honor a national holiday that was probably established by the larger dominant culture? You know, how do we honor what people value in terms of, again, the details? It's in the little things that we might include in the manual that may support them and serve as a written reference for how they feel protected and supported by the agency. And in thinking about our team cultures, it's also helpful to think about the parallel process, right? The phenomenon where the manner in which we treat our teams is the manner in which they'll treat the individuals and communities that they serve and support. So if we treat our staff with dignity and respect, they'll in turn mirror that relationship with the folks that they support in the community, and on it goes, kind of like a ripple effect. One other thing that I was thinking about is it might be helpful for us to adopt a trauma responsive lens to our workplace culture. One thing that immediately comes to mind is allowing more voice and choice among our team members. Are we fostering and investing in people's career interests and aspirations? Again, tall order, because there's so many competing demands, right? For instance, if your colleagues have a particular interest in a topic of practice, you know, let's say they want to expand on their practice of CBT or DBT, are we offering opportunities for them to get further trained to expand their knowledge and skill set in that topic, to then feed into their ability to serve the communities that your organization represents? Fueling people's passions can only not only add to the morale, but also add to the productivity of the organization, and in turn, long-term organizational health and resilience. I don't know if you had other thoughts about that, John.
Well, you know, I just want to add a sort of what I think would be an interesting dimension to the conversation, because I was somewhat mindful of some, you know, recent actions at the federal level recently. We look at something like equity, diversity, and inclusion and training. You know, what do we do when we encounter what might be considered, or what might definitely be racist policy? If we say, for instance, that we're going to, if we say, for instance, that it's racist to suggest that, one culture might be racist relative to another culture. That very conversation is somehow signifying racism. And so we're not going to do any more training that would suggest that there is something like systemic racism, or that there's not something like some inherent injustice that's a part of the fabric of, let's say, our court system or something, right? If we're going to say that you're not allowed to have that conversation, I think that there's an element here of what is the broader culture and how do we influence it? And if we take responsibility as an organization that does value all, and it is willing to at least be reflective and taking its own temperature and saying, to what extent are we living up to the standards we would expect others to live up to? And if we find that that's the case, that we're doing it well, but we're find ourselves impeded, how do we work together across organizations to create safety zones? So, and to push back on local government, state government, or national government where that's an appropriate thing to do. Now, again, I'm not suggesting, that this is all about some kind of a civil disobedience thing, but we're talking about a resilient organizational culture. And there have been organizations that have stepped right in the middle of many social conversations and exhibited organizational health in doing so, and really helped the community to be in a healthier place. So I just want to just say that I think that's an important part. It's a little bit off topic, but I think it kind of helps to create, I think to the extent that we encourage people to have some critical thinking, it really, I think it helps toward healthy, resilient organizational cultures.
Yeah, thank you for bringing that to the table, John. I know, again, off topic, and I'm just speaking for myself, but I think it's helpful for us to think critically about who's making the decisions in our organizations and what kind of culture that's reverberating towards our larger communities. I think there's a difference between promoting someone for diversity reasons, I dare I say tokenism, but really making that decision impactful in allowing people to take diverse people, dare I say people of color, minorities in our communities, to take on leadership positions and really giving them the authority to make decisions that will make impactful changes that affect the larger community. When we're talking about how the work and the composition of our teams should be reflective of the communities in which they serve, I would say that a majority of the teams that we work with might be people of color, but oftentimes not a whole lot of them are in leadership positions that can really make impactful changes. And when they are in leadership positions, perhaps, they get lost in assimilating to the crowd that they're in, and no amount of change is created even when they have those positions. So, end of tangent there. I think if we move on to the next slide, we're talking about tools and resources. I think we actually, did we skip that slide? Sorry. Talking about workforce retention and promoting wellness and a healthy work environment. I think just to touch on very briefly on workforce retention strategies, one concrete strategy is to ask for your team's feedback on what makes a workplace feel supportive. Are we giving space to the idea of mutuality by allowing our teams to rate our performance as leaders as much as we're rating their performance as staff members? And in terms of HR, taking on the neutral stance of surveying the whole agency on what they think makes or breaks an organization's resilience. And taking it a step further, what are we doing with that feedback? If we think about what would give us a reason to stay at our current organizations, what are those reasons? And are we applying the same reasons to the rest of our teams in terms of what you said, John, about the hierarchy? Are the reasons that make us stay as leaders the same reasons that those team members as our supervisees, our team members, are those the same reasons that they're applying to their reasons to stay? And I think Danielle and Eve had spoken about this in previous webinars, but retention is such a cost-effective way to boost morale and productivity, to invest in workforce development. It's creating a culture of self-care that doesn't just leave things to EAP, but really building that in to the day-to-day operations. Examples might be, flex scheduling for homeschoolers, especially during this time. Informal Zoom lunches with coworkers where you don't talk about work. That's just the rule, kind of like Fight Club. You just don't talk about work during those work lunches to really nourish and replenish people's energies, to go that extra mile, when encountering that afternoon slump. Leave of absences, online and on-site support for people with tech issues. Who among us have experienced some tech issues in navigating this pandemic, right? Hopefully I'm not alone. I guess raise your hands if that applies to you. And I guess taking into consideration and acknowledging and accommodating different definitions of wellness among staff. What might look like wellness and self-care to me might look differently to a colleague of mine, and how do we kind of accommodate both of our definitions of wellness in the team culture and what we implement together.
We're going to go into some discussion about tools and resources. We're not going to get into a lengthy conversation with you about each of these. There's a pretty broad list of tools and resources that CTAC has, and Marlo's going to, I think Marlo, we're going to get into a couple of those, yes?
Oh yes, definitely. I know we've listed quite a few here, but we'll be focusing on only a few interview questions and a sample job description. So on the next slide, we actually have a sample of a resource that CTAC is offering around an interview guide to get a better sense of an interviewee's leanings toward integrated health. And one example question to get a better sense of a person's openness and orientation toward practicing integrated health might be the question around scope of practice. How would you define whole health? And if we were to look for answers that include monitoring chronic conditions and addressing social determinants of health, we might get a better sense of the person's orientation towards this concept of integrated health and their ability to address both behavioral health and physical health, whole health into their practice. And one other question that we could pose in getting a better sense of someone's knowledge, understanding, and attitudes toward health is, what are some strategies you might use to help an individual improve their wellness skills, which doesn't just take into account symptom monitoring or management of diagnosis, but really taking a look holistically at a person's toolkit for their whole health. Various dimensions of wellness could be taken into account. Other interview guides, I guess in the next slide, might entail questions about a person's orientation toward a recovery-focused approach to partnerships with people. One question that we can pose in our interview question could be, how is recovery the same or different as treatment? And there is a difference. And getting a better sense of a person's response gives you a better picture of this person's approach to partnerships with individuals in our behavioral health system. And getting a better sense of attitudes towards recovery might involve questions like, or prompts like, describe the likelihood of recovery for people you've worked with in the past in other programs or agencies, or how do you respond if you think a person that you're working with is making a bad decision that you don't agree with, and having the person kind of critically think about their own backgrounds, their own biases as it relates to this space of partnership with a person, and you get a better sense of their person-centered orientation. I think too, I think we've mentioned in previous webinars that perhaps it's helpful to pose situational or scenario-based questions of like, what would you do if a person was feeling really suicidal at this moment, and you as a staff member have very strong religious beliefs about suicide? How would you navigate this space given your background and perspective and this person's situation? That'll give you a better sense of who you're recruiting, what challenges might be ahead if you do decide to recruit this person, and how that comes into play to your larger organizational culture. I think we have, I don't know if you have other things to add, but in the next slide, we have a chat question, I think.
Yeah. Just, you know, for folks who just take a little bit of a breath and you know, just think about the, you know, tools that Marlo just spoke about. Do any of these questions, or how could these questions help you to recruit and hire employees? And are there any other you know, the conversation that Marlo just had with you, any others, you know, that you think would be helpful? And also, do you have any in your own organization that you think focus around whole health, for instance, you know, and how, you know, you might use some of the questions like this to hire staff? Or do you have any, you know, again, I think another way to ask the question is, you know, could you talk a little bit about how your organization attempts to infuse, you know, the fundamental beliefs in your organization around, you know, the questions that you ask in the job interview to make sure you're getting a good fit?
So I'm gonna jump in, folks. This is Daniela again. So I'm just thinking, this question makes me think about when I was, I used to run a pros program before I started at NYAPers, and whenever I was hiring staff, I used to ask questions all the time that were scenario based, just to kind of help me get an idea of who was, you know, coming through the door, and did they, you know, did their orientation align with our organization's mission, vision, and values? Was it, you know, was it a scenario where I had to sort of help them learn the skills that they needed to do the job, but they had those sort of soft skills, which I know we're going to get into in the next slide, and just sort of always weighing those two when I had to make a decision about who I was hiring. So it just made me think about that.
Oh yeah, and I mentioned, you know, that depending on who you wanted to hire for whatever reason, it could mean just keeping in mind some of the challenges you might encounter depending on their orientation. And Absolutely. It doesn't necessarily have to be whole health or person-centered approaches. It might depend on the values of your agency. If your agency values, let's say, the dignity of older adults or mature adults, how does this person see the role and the needs or the strengths of mature adults in our society? Or if your agency really stands for social justice, maybe questions around their concept of and I saw in the comments, you know, how do they define issues around race, or the difference between a discussion of anti-racism and racism, period.
And when you think about, you know, just to take that question and apply it to this idea of sort of soft skills, you know, there's an aspect of you know, the hiring process that is a little bit more intuitive, a little more of a sense of who people are and where they're coming from. So in addition to having a specific understanding, let's say, about social determinants of health, you know, is this person demonstrating an ability to, you know, empathize, understand, and speak in a manner that reflects compassion and value for the fundamental, you know, sort of worth of all of the people that person will be encountering in their work and as staff as well. And so, for instance, is this somebody in this environment, you know, if we want to be an anti-racist organization, that involves a difficult process of really taking our own pulse of really examining our own behavior, our own attitudes, and our own, you know, history, and sort of on some level purging any connection with racism and trying to become a force in the community, a force, say within our own staff of demonstrating, that the value for each individual person, and ensuring, that we have diversity, ensuring that we have equity. And again, I really like all of the dimensions of our conversation that involve sort of across staff. It's sort of value of and integrity of the person supersedes different, in quotes, levels in the organization. It's like there's no one human being who's more valuable than another human being, and are we reflecting that in all of our practices? And are we also is our organization anti-racist? And so again, I think empathy and compassion involves not just our staff and our staff team. It involves the work that we have with the people that we're serving, but it also involves when we get into a conference room or a Zoom call and we've got 50 people in the room, are we carrying the same value system into those meetings? And are we calling out when the dynamic is not supportive of diversion, of diversity and equity and inclusion? And again, communication, how clearly the person is communicating, the words that they're using, non-judgmental, et cetera, et cetera. These are all really important skills in addition to the very concrete skills we talked about a little bit earlier.
Yeah.
And I would just jump in and add, oh, sorry, Marlo, I was just going to jump in and add that, like, when we're talking about recruiting, we're not just talking about recruiting the line staff, right, and using some of these tools and getting people's orientation for the direct care staff, but also looking at, the entire organization and all levels of staff throughout the organization, whether it's, a finance director or an HR director or an HR generalist or a maintenance person. What are their soft skills? What is their belief around recovery? Because everybody sort of communicates and interacts with each other, and that culture is affected by everyone, not just, the folks that are providing direct care services.
Yeah, I think, Danielle, you and Eve had previously talked about, well, what would be the threshold for everyone in our organization, regardless of their role, to have in terms of their understanding of mental health conditions? Because I know the larger public may not necessarily be privy to our level of understanding, but what is the minimum level of understanding that people should or might be helpful to have for everyone in our agency to be able to enact work that is in alignment with the values? One thing that comes to mind that is very entry level to have a basic knowledge around mental health might be mental health first aid, which is, sorry, not a plug, it's not an ad for the National Council's mental health first aid, but it really gives the layperson, whether it's a janitor or your reception desk person, a better sense of the work that we do, because oftentimes not enough people in the general public know what we do in our system.
So before we move on, is there anybody who wants to either in chat or if you unmute yourself, which would be wonderful, do you want to talk a little bit about how you think that soft skills contribute to your organization's culture? Do you have any great examples of how soft skills contribute to the organizational culture in your organization? I want to just point out one real quickly, if others, I think it really makes a huge difference about how we address each other in communication, staff meetings and elsewhere. Are we talking to each other as human beings, or are we talking to each other as positions in an organization? And they're not mutually exclusive. They don't have to be mutually exclusive, but if there's a fundamental value for the contribution that everyone is there to make, and we're treating each other with dignity and respect, makes the business of what we got to do very, very different than if we're not doing that particularly well. And I think it makes a big difference in the culture and the morale of an organization.
Right, so I think, John, you're mentioning, let's say you have a new social work intern in your agency and they join a staff meeting. Are there comments and questions weighing the same as that of your top leadership? Yeah.
So I understand your point, John, in that we all communicate initially to each other as individuals. And at the same time, right? There is a hierarchical thing that that doesn't have to be, but that is acknowledged as well. Do you know what I mean? We're not having a casual conversation usually in staff meetings.
Right.
But to your point, I think creating part of the soft skills is creating a culture where having a differences of opinion is okay.
Yep.
Mm-hmm.
Yep.
Yeah, I think, I don't know if it goes along with that, Clinton, but when leadership makes decisions, sharing with the staff the rationale for those decisions can help the staff think critically about what went into that decision and whether it makes sense for the health of the organization, or how it makes sense to the health of the organization, rather than just hearing a decision being made and not realizing how it makes sense for the organization.
No, that definitely helps. I think you guys mentioned before about transparency and being authentic. So yes, that definitely helps.
Yeah, and I think the other thing is sometimes it's very, very clear that somebody in the organization has a responsibility, and that responsibility is going to involve making a decision and then letting staff know what the decision is. And everybody's clear on that. And sometimes it is not a necessary step to ask for input, to ask people like what they think about, the particular issue. But you do ask. And then there's an understanding, afterwards, thank you very much for your opinion. I really appreciate it. And I will give it some consideration as I'm making the decision. And it might not be very clear, like how that was taken into consideration, or maybe it couldn't have been, whatever but sometimes you get asked for an opinion when you don't have to be asked, and it makes a big difference.
So I guess attracting the right person, it also involves being clear, like John had mentioned before, around what we communicate when we advertise job descriptions, and including descriptions that really reflect the brand, the mission and values of our agency for the candidates that are in our pool. One thing that we might include is an overview of our organization, what that entails directly or indirectly about what we stand for and our principles around recovery. And in addition to an overview of our organization, to just be upfront to candidates about what we're about, is details in the job responsibilities, the wording, the little things that communicate our values for person-centered recovery-oriented approaches to the work that we do. Words that reinforce that, that individuals are really driving services. And again, that notion of choice and voice that hopefully our recruits would honor and respect.
Great.
And I think we have an example in the next slide, right? So one example of this might be a detail around working together with clients to help them develop coping skills that will help them manage trauma responses in effective ways. Another detail in the job description might involve a minimum of 3 years experience working with people using a recovery-oriented perspective. And further detail to that would be partnering with individuals to develop skills to help manage strong emotions and familiarity with strategies to manage chronic conditions such as diabetes and hypertension. Gives you a sense of their focus on whole health and a trauma lens for the work.
And it's kind of an interesting mix of the soft skills and sort of the more sort of concrete skills. The first one being to be a little bit more reflective of softer skills. So it's kind of interesting.
Yeah, and in the current climates, maybe taking a look at our job descriptions if we are recruiting and seeing how we can pivot some of the wording to account for the current landscape of services that are being delivered. I know previously Danielle and Eve had noted that because we're ever moving towards the frontiers of virtual services, it's no longer a niche service, it is becoming more mainstream. And how do we reflect that in our ability to recruit new talent? So I guess a few takeaways, because we're nearing the end. Yeah, however you choose to advertise for new positions in your organization as HR, in the role of HR or otherwise, a few takeaways might be ensuring that the position you're hiring for is the job you are posting for, and having, again, as John said, that alignment and consistency. And conducting ongoing assessments of, how is our organization doing? Are we consistent with what we are saying we're doing? Are we walking the talk, essentially?
So it'd be really great, as we're kind of nearing an end of our time together, just to it'd be great to hear a couple of examples where you think your organization might be strong as it relates to health and resilience. And I'd be particularly interested in examples that related to, COVID or to diversity, equity, and inclusion. Two of the huge areas of focus that have really emerged as a really necessary and needing our attention, significant amount of work. So if anybody has any bragging they want to do about what's going on in their organization in that regard, it might be helpful to all of us. And then also just, what do you think are the priorities? What are the areas where you're really feeling like a lack, where there's a real need for work? And Marlo and I will and Daniela will definitely, tune into any areas where you see there's a particular need. Maybe there's an opportunity for future technical assistance. So things you'd like to brag about, things you'd like to maybe need a little bit of help with. Let me kind of open it up.
Does anyone have any tips that we haven't covered here that work really well for your organization, so we can draw inspiration from it?
I would say, just to give you all an example, for us at NIAPers, I think communication is super important. We have weekly management meetings that took the place of our monthly management meetings, and it's just a way to sort of keep everyone organized now that we're all working remotely. And it's a way for us to all sort of know what each other is working on and, pitch in when somebody else, needs a little bit of help to meet a deadline or something like that, especially since everyone is working from home and has lots of other potential issues that could arise when you're working from home. And that's another thing, I think, which is also another strength, is understanding that, your workforce has gone through a trauma, right, of working from home, and is still going through a trauma probably. I say this lovingly, but I used to work from home a few days a week, and I was alone, and now I have 3 kids, 2 dogs, a cat, and what do we have now? A hedgehog and a snake. So it's like I never know what's going to happen. But feeling that support and feeling that flex scheduling and things like that, all of that is really helpful for me as I sort of manage through this.
Oh my goodness,
So
you're the perfect example of an answer perhaps to the question that Doug posed of how do you balance everything out? My goodness, you have a snake, you have a hedgehog. One of my colleagues has a guinea pig. In addition to
we have a lot going on.
Yeah. And I think you mentioned the support that
we're doing virtual work. We still have to do our jobs, right?
You and your teams have probably experienced quite a massive range of growth and skill building during this time. My team also, we've had to there was a meme where it asked the question, you know, what led to the digital transformation of your team? Was it your CEO? Was it your CTO? No, it was COVID. So here we are.
Yeah. So maybe as we're getting ready to end, we'll talk a little bit about the upcoming events. One of them tomorrow on employee engagement, and so just, you know, I strongly encourage people to go to the CTAC website, and the tools that were all mentioned earlier today are available there, and then also you know, just to make sure you visit both the MCTAC website and I guess we have the link for the cultural assessment questionnaire as well. So really, you know, encourage you to use the resources that are there. It could be really, really helpful. And if you have any questions, you can send them to CTAC. You can, you know, reach out to Marlo or myself, and also Daniela, if there's anything more we can do for you. I wanted to say thank you to everybody for participating, for joining us today, and you know, and thank you to Marlo for being such a good partner, and Daniela, thank you, and to our host in the control room. Thank you,
Tara. Thank you. Thank you, John.
That
and
virtual
Daniela.
control room.
Yeah.
Yeah, and Tara actually just put in the chat box the link to the workforce priorities page on the CTAC website. So on that site you'll find, or on that page rather, you'll find all the webinar recordings and all the slides from the entire workforce priority training series. And then, like John said, you know, we really do encourage you to, if I can figure out how to make these slides. Oh no, go back. Here we go. Tomorrow there's another webinar on employee engagement, and then the last webinar will be around some human resource tools. So we encourage you to please register for those as well.
Thank you, everyone. Happy luncheon.
All right, folks.
Thank you
Have a great afternoon. Thanks so much for joining us.